My name is Desserie Morgan. I'm a registered nurse at St. Joseph's University Medical Center in Paterson, New Jersey. When did I decide to get into the helping people business? I was really young. I was 13 years old. I became a candy-striped nurse in Palisade General Medical Center in North Bergen. When I was young, I did play nurse. When I was young, I probably played doctor or whatever. I was always the person doing the bandages or reading Nurse Nancy and imagining myself as that nurse. So yeah. How has the pandemic changed my life? I don't sleep like I used to. I dream. When I do sleep, I'm dreaming constantly about COVID. I'm worried. I'm a manager as well, so I do. It's my responsibility to make sure the people who report to me are safe. So when I'm at home, I'm worried about my family. When I'm at work, I'm worried about my family at home. When I'm home, I'm worried about my family at work. So it's my job to keep them safe. I guess I take it on when I go to bed at night. I sleep. I dream about it constantly, so I never get that restful kind of sleep. So in that sense, there were, 7, 8 days where I hadn't really slept well at all. And I just decided, I need to really start to try to take better care of myself. But when you're constantly thinking about what's going on and constantly thinking about it doesn't give you any reprieve from the constant, the news and what you're dealing with all day long. And when you come home, everything has changed. My mental health has changed. Hugging my children and kissing them, which is such a natural thing to do, I worry that I may be infecting them. So I'm a little more, so concerned that I'm going to get them sick. I'm a little more standoffish. So I find myself pulling back some. After I do hug them or kiss them, I say a prayer. God, please don't let me have given them anything. And I don't know that that's going to go away. I feel like it's a part of me that now is kind of damaged, where I'm always going to think that there's something, I'm giving them something. So that part of me, that part of my life has changed. I hope not forever, but I'm worried that when I talk to somebody, I try to get a really good look at them and remember them, because I feel like I may not see them again, because you just don't know with this thing. So that piece has changed. It's terrifying. About putting strangers in front of my family. I really don't think about it. I know that I would want my family members to be first and foremost of anybody caring for them in the hospital. So I really don't give it a second thought. I'm a nurse. That's what we're supposed to do. If you're called to this profession, you just feel the need to help people. So I definitely don't. I don't feel that I'm putting them in before my family. I feel like I'm doing for them what I would hope somebody would do for my family. My worst day so far was when it was on a Sunday. I was a supervisor for the critical care department, and was called in by a frantic critical care physician. We have a program in the hospital that my patient relations had created, where we have an iPad. We're not allowed visitors in the hospital because they don't want to, expose anyone. So a lot of these patients, all of these patients, don't have anyone there. There's no family visits. And for those that have been there for a long time, they really haven't seen their family. So what we do is we take an iPad and we bring it in so that the family can see them. On this particular Sunday, I received that phone call from the physician asking me to find the iPad immediately and to bring it over to critical care. And I told him I really didn't have, the patient relations wasn't there, I had no one to do it, and he said, we have about 2 minutes before this patient passes on us, before this patient dies, and the family needs to see them. So I ran to critical care with the iPad, and in that short phone call, I wasn't given the opportunity to know what I was walking into, so I was not prepared. And when I got inside the room, and it was just myself and the patient, and I turned the iPad on, I dialed the number, and I saw it was a 12-year-old boy and his 8-year-old sister. and their mom saying goodbye to the patient, who was their father. And I have 12-year-old twins and a husband, and I couldn't disconnect from it. And I was staring. The way the iPad communication works is you see them and they see the patient. So I was staring at them, begging me to please do something to help their daddy. And I knew he had minutes, if even. And I just kept saying, honey, you may want to just talk to your father and tell him, that you love him. And the mom was on the other side trying to tell them, say goodbye to daddy. And it was so heartbreaking. And I fought back as much as I could as far as not letting them see my tears. And when it was over and I left the room, that same physician came and said, I'm so sorry to do this, but we have another one right next door. Can you please come? So I went next door to the next room, and I had to do the same thing. But this time it was a 19-year-old girl and her 15-year-old brother saying goodbye to their mother. And so I went through that as well, and I just could not shake that. I couldn't stop thinking about it for days. I saw the pain. I heard their voices in my head. I couldn't get past that. So that was definitely the worst day of my life.
What's the best day?
The best day. Whew. Oh, sorry. The best day was anytime I hear the Rocky song. So in my hospital, they do an amazing job of celebrating discharges. If a patient is discharged from COVID, they are able to push a button on their way out and it plays the Rocky theme song to just tell them what champions they are. So whenever I hear that, I'm having the best day. A patient who's touched me or that I've grown to love through this COVID, I would say it was probably the first patient that I had hands on. The first time I was in a room with a patient that was not doing so great. I was fixing her IV, and as I was fixing her IV, her other hand reached over and grabbed me to hold my hand, and I realized at that time she needed more than just me fixing her IV. And she just looked at me, and I knew she was terrified, and she was, her oxygen was desaturating, and I knew she was going to have a rough next couple hours, and that she was probably, a very good chance that I may be the last person or one of the last people who talked to her before she has to be sedated for intubation. So I tried to make her as comfortable and calming as I could, and I was just looking in her eyes, and although I was trying to limit my time in the room, I knew that she needed me a little bit more than I had anticipated. So I stayed in that room and I held her hand and I just looked at her and I told her that I'm with her, she's not alone, she's going to make it through, and she said to me, I love you, you're an angel. Whew. And at that moment I knew that although I was terrified that I was spending too much time in that room, that I was doing something right, and that, I had to be there for her in that moment. So I think about her, I followed her. She did wind up getting intubated, and I did follow her to find out how she did, within the next couple of days to see how she was on the next unit. So that's one patient that touched me. Did I ever think I'd experience a pandemic? I was prepared. We were all prepared as nurses. Task-wise, knowledge-wise, educationally, we were prepared. Did I actually think that I would be in one like this in my career? Absolutely not, and you can never emotionally prepare for it. I couldn't, at least. So no, I was not emotionally prepared, and I never thought that I would have to go through this. No. My kids are like every other kid. They want to be social. They want to go out. And a lot of their friends are having secret play dates and maybe, minimizing what's going on. But my children are children of a nurse, so they are not angry with me when I say no. They're angry with the virus. They're angry with the pandemic and what it's caused because they're full of knowledge. They understand. I've been very open and honest with them. I've told them, you know, why. They know the why they can't go out. And for them, they're 12. I have twin 12-year-olds and a 13-year-old and a 25-year-old. The 25-year-old gets it. The 13-year-old and the 12-year-olds are in that peak socialization moment, and they're not angry. They get it. It hasn't affected them in that sense. They're more angry with the virus. Why did this happen? Questioning why it happened. But they get, you know, again, they're real resilient. Post-pandemic, I would never know. I don't second guess this career at all. This is all I could have ever imagined doing with my life. It's the only, I mean, with the amount of hours, nurses work the worst hours. We have the worst, we work every holiday. We work, you know, we don't get days off. Like, we work 12-hour shifts and weekends, every other weekend or whatever. So you have to love what you do. You have to feel like there's a purpose for what you do to become a nurse. And I honestly feel that there is no way in this world I could do anything else and be happy. Some days are not so great. Some weeks are not so great. But I still feel like if I wasn't a nurse and I didn't pursue that, I would always feel like something was missing. So no, I don't think it would change. Oh, the teamwork. I have got to say, I cover 2 units, a med-surg overflow unit where there was a ton of COVID patients, and a psychiatric unit. The teamwork throughout the whole organization is absolutely amazing, and if there's anything that came out of this, it's units and divisions that never really knew each other now know each other. We have had a tremendous, from the top down, from the top of our organization to the community, we have had so much. Everyone needs to be involved to be able to make this successful. Nurses who didn't even know each other, never worked with each other, writing names across their face shields because you just don't even know who you're working with that day. But you were family, and in those 8 to 12 hours, you needed each other. So I had some of the most amazing experiences watching people just connect and work together seamlessly who had never worked together before. What I would want to say is just when this has passed, we are going to need, everybody on the front line is going to need to heal mentally. We're going to need to make sense of what happened, process what we went through. We're going to need support, and we're going to need to be real mindful of our own mental health because it may be over physically, but mentally it has taken a toll. It has taken a toll.